Awesome. Thank you very much. Thank you very much, Kim, for the great introduction. Welcome, everybody. Thank you very much for taking time out of the middle of your day here to join us on this webinar. Really looking forward to it. Back pain and treating it without drugs or surgery or invasive methods is something that I've always been very passionate about in my entire career. And as Kim mentioned, prevention is a very big part of what I do and why I started my practice in the first place. So as Kim mentioned, my name is Dr. Phil Finemore. I own WorkFitME Mobile Concierge Physical Therapy, where I help busy Maine professionals just like all of you maximize their physical performance so they can live a happy, healthy, and wealthy life doing what they love with who they love. I'm really excited about this today. So before we jump right into it, because I know we've only got we've got the hour here, and there's plenty of things to get to. I wanted to make sure everyone is comfortable with just some of the functions, because as we go, we'll be using potentially using a little bit of the chat function as well. So if everybody is comfortable using the chat, if you could just type hi or me or something like that, just so I know that you guys, all of you, are able to access that and use it well. If you hover over the screen and right at the bottom it says chat, you just click on that, you type your message, hit enter, and it will send. All right, already got some rolling in here. Monica, great. Joanne, great. Kim, great. Missy, great. Awesome. Lefty, great. Wonderful. That's awesome, because we will definitely use that. Sherry, awesome. We'll definitely use that for questions. Please feel free to type questions in the chat as we go, okay? There's definitely going to be a question and answer session at the end where you all can unmute yourselves and ask questions. But if you have stuff that you really want to know or want me to explain a little bit more throughout the webinar, please, by all means, throw it right there in the chat. Lois, thank you. Great. I think we got just about everybody there. Awesome. We are all set and ready to go. So what we're going to cover today is conservative treatments of back pain. And I want to get into a few things to kind of set the stage for that a little bit, almost bust some myths a little bit. There are a lot of things that people hear about back pain out there that some of which are true to a degree, some just really aren't, some that wind up scaring people about back pain more than it really should. So I want to make sure that we go through a little bit of that to kind of set the stage, and then we can talk about some different ways to manage back pain without medication, without surgery and other invasive procedures. And if you don't have back pain, how to prevent it from happening. I am going to go over a few different exercises with you all that you can kind of implement and start using to do just that. But let's dive right into this here. I am going to do a screen share. We're gonna start talking just a little bit about the anatomy of the spine, just so we can sort of get oriented to some of it real quick, and then we'll start diving right into things here. So let me share my screen here. Wonderful. Hopefully you can all see that pretty well. Definitely type something in the chat if you cannot see it, or unmute and just let me know. But so basic anatomy of the spine. This over here is on the left side of the screen is what the spinal column looks like. So we have the cervical vertebra or the neck. There's 7 vertebrae there. We have the thoracic spine or the thoracic vertebra. There are 12 of those there, and then we have the lumbar vertebra, and there are 5 of those here. So this sort of natural S shape. This is the front of your spine. This is the back of your spine over here. This natural S shape is what we call quote unquote normal. I say quote unquote because what's normal, right? But we call that normal. So we're supposed to have an inward curve here, outward curve here, inward curve here. All of this sits right on top of the sacrum, okay, which is down here. Your pelvic bones are on each side of the sacrum, so that kind of holds everything together. That's important because the hips and the pelvis and the spine are all very interconnected. We'll get into more of that later. But that's the sort of the bony alignment of the spine. Each one of these vertebrae have joints on either side, on both sides, with the vertebra above it and below it. So you can see here in this picture the facet joint. That's what that's showing right there. So again, this is the back of the spine. This is the front of the spine on this picture. So they have a joint with each vertebra above and below it. There is a disc in between each level of the spine. And right down through the middle of the spine is our spinal cord. And these little openings here, which you can see all these little openings over here on the spinal column picture, that's where our nerve or our nerve roots come out. Those nerve roots then either form together with other nerve roots or go out on their own and become the nerves that go all over our body, which help our muscles move, give our skin sensation, let us know if something's hot or cold, if it's light touch or deep touch, where we are in space, all these different things that our nervous system is responsible for. And that all originates from the spine. So when we have back pain, it really is the irritation of nerves that causes most of those symptoms, whether it's locally in the back where that problem is happening, or whether it's radiating out away from the spine, going down in the low back, specifically going down into the hip or buttock area, or down the leg and even all the way down into the foot. It is the nerves being irritated that actually causes that pain. So I'm going to stop my screen sharing for a second here. So that is, that basic overview just goes to show you how very interconnected all of those structures are. There are a lot of different structures in the spine in very close proximity to all of those nerves. That is why back pain can be a little complex, and why we have to treat each bout of back pain differently, because there are multiple structures in the spine. We also have, one thing I didn't mention is the musculature on the spine, which lays right on top of that spinal column. Any of those things can cause pain. However, each one of those is going to present a little bit differently. The pain you experience might be the same, but the things in life that it interferes with, or that it makes it hard to do, are going to be different. Okay. And that's the important part, is not all back pain is the same. So if a disc bulge is causing your back pain, or pain going down your leg, that is going to be present a little bit differently and needs to be treated differently than arthritis in the spine, you're pinching on that nerve and causing pain in your back or into your legs. If we treat it all the same, we're going to miss the boat completely, and certain things can actually make things worse if we're treating things across the board the same. So that's why quick and proper evaluation and treatment of where the pain is coming from is very important when we're talking about the treatment of back pain. Okay, so that's kind of the first myth I wanted to talk about, is not all back pain is the same. Okay, it's all different. It depends on what structure is causing it, and based on a physical examination, as well as the things in day-to-day life that pain is interfering with, we can combine all of that together to really determine, even without imaging, and that's key right there, even without an X-ray or an MRI, we can have a really good idea of where that pain's coming from and start a proper treatment program to hone in on that cause of the pain and take care of it. Okay. That doesn't help us as much with the prevention side. We'll get into that in a little bit, but as far as treating pain that you currently have, that is key, is knowing that, getting evaluated quickly and making sure that we identify the proper structure that's involved in order to get the proper treatment plan going. Those are real important. So I know I went through a bunch of stuff there. Again, if y'all have questions as we go, please put it in the chat. I'd be more than happy to answer some stuff as we go, and we will have a Q&A at the end of the webinar, as well as a couple things that I want to make sure that you all get and can take advantage of as well. So moving on from that, I want to hit on the imaging thing, right? Because some of you probably were thinking, oh, I don't need imaging to actually find out what's wrong with my spine. And the answer to that is you do not. X-rays and MRIs are not absolutely necessary to treat back pain, whether it's new back pain or acute back pain, or whether it's chronic, whether you've had it for a long time. And here's why. If we took 100 people of varying age groups and did an MRI of their spine, in somewhere between 40 to 60% of those people, this is on average across kind of the lifespan, let's say from the mid-20s and up, somewhere between 40 to 60% of those people would have positive findings on an MRI, including disc bulging and arthritis, or what we call stenosis, same thing, with zero pain whatsoever, right? So just because those findings are there on an image does not mean that those are the reasons that you are having pain. And that's why a lot of people get nervous and scared about what was found on an X-ray or an MRI of their spine, is because they found, multiple levels of the spine had arthritis and there were multiple disc bulges. And that's probably normal. For most of us, that's probably normal. What happens is we develop certain patterns and movement patterns and compensations in our body, in our movement patterns over time, which leads to increased stress on a certain segment of our spine. And that's when a disc bulge that might have already been there, or arthritis that is kind of naturally happening anyways, starts to put stress on those nerves in that opening, as I showed you in that picture. And that's when that pain develops, right? So, and those numbers go up the further up in age we go, because our spines hold us up all day. They support us all day long. And they do a lot of work, not just to hold us up, but also to move, right? When we bend over, when we reach overhead, when we reach out to the side, when we turn and twist. And if we do certain things repetitively in our day-to-day life because of our work or our hobbies or whatever the case might be, some of those stresses are even higher for some people. We take some muscle imbalances where certain muscles get kind of weak because we're not targeting them with our exercise program, which even if you work out regularly, there are many areas that I find are still weak for some individuals. We're going to go over some of that later on with some of the exercises that we talk about. But some muscles get weak. Some muscles get maybe a little overactive. Some areas get tight and don't move well. Some areas loosen up and move a little bit more because our body still has to move. It's going to find that path of least resistance. That leads to stress in and around some of those nerves, which can lead to pain. And again, as we get older, when you look at, if we took 170-year-olds or 180-year-olds, that percentage is probably more like 70% of 80% have changes like disc bulging, loss of disc height, stenosis in their spine, arthritis in their spine, with no pain in that area whatsoever. So just because the finding is there on the X-ray or the MRI doesn't mean that that's the thing that's causing the pain. That's where a good exam comes in. And with a proper exam of that area and areas around it, we can usually identify what the problem is without even having to have imaging present, or having had imaging done before we do that physical exam. Okay, so that's another big myth I hear. Another one, sticking with the age, the idea of age being a factor with pain in general, but especially with back pain. Age does not automatically equal pain, right? We don't have to put up with pain just because we're aging. And that's where, again, that physical exam and finding those imbalances that are going on, finding those smaller stabilizing muscle groups that people don't tend to focus on in their exercise programming, so things get weak and don't activate well and don't work as well as they need them to do. Honing in on those things and fixing those, along with fixing areas that don't move well, stabilizing areas that move too much, can all work together to take stress off of an area, even that is arthritic. Like knees, for example, the only way that we're going to get rid of arthritis in a knee is by doing a knee replacement. However, prior to the knee replacement, if we improve the stability and mobility around that area without ever doing a surgery, conservative treatment through movement and exercise and hands-on work to get that knee moving better, can avoid a knee replacement altogether. I've seen that and done that many times with folks that had that exact problem. That's also true with the spine. There's nothing that a physical therapist will do that will completely remove a bulging disc or increase the height of the discs, which naturally get shorter as we age, or take away arthritis in the joints. However, if we get that area stabilized a little bit better, get areas that are tight moving, get areas that are weak stronger, we can take stress off that spot and calm that area down without ever going in there and doing anything. Lifestyle changes are a big part of that as well. So again, if I'm moving a little too fast or people have specific questions, please throw them in the chat. We got something right here. Do you have examples of how pain can be addressed for someone in their 70s who has very advanced arthritis that has become life altering? Yes, definitely. Great question. So let's pick that example right there. Someone 70 has advanced arthritis in their spine. Let's say they've got pain in their back. Pain goes down the leg. They have some numbness and tingling in the legs too. Maybe it's one leg. Maybe it's both legs. What we're going to do is identify where ultimately the pain is coming from, kind of hone in on the levels of the spine, which we can do by finding out where their pain is, where some of that numbness and tingling is going. We can actually relate that back to a certain level of the spine. We're going to get that area opened up a little bit more through some hands-on techniques. We're also going to find areas through the core, through the hips that are not activating well, muscles that need to be woken up a little bit to help stabilize the hips and the spine a little bit better. We're going to identify areas in that spot as well as above and below it that maybe aren't moving as well. Because I often find, like in this example, if we had someone in their 70s with advanced arthritis and a lot of pain, I find that the area where that's coming from is doing more of the moving in their spine in order to move around, like bend over and twist and reach overhead, because their upper back is very tight and stiff and the vertebra below it are very tight and stiff. So that one vertebra is doing all the moving. And when that's doing all the moving and there's a lot of arthritis there, it closes down on that nerve. Nerves don't like to be closed down on. They like movement, space, and blood flow. And when that's taken up by arthritis and then we move on it a lot, that nerve gets angry, and that's what gives us pain and numbness and tingling. So we're going to look at all the areas all around that segment where we primarily think that the pain is ultimately coming from, and find some balance in that area. Again, I had mentioned before that the hips, the musculature in the hips have a lot of direct connection to the stability of the spine because they connect up to the pelvis and the sacrum, that bone that we looked at in the a picture of the anatomy at the start of the session, and securing that area up so that when we are moving, the spine and the low back are stabilized with the right muscles kind of on all sides of that area. And we're also going to address the core. So this is actually another one of those sort of myth type things that it's the six-pack muscles or the obliques, right? You hear some people talk about that really make up our core and need to be stronger when we have back pain. But if we strip away those six-pack muscles and we strip away the obliques, we're left with the diaphragm, believe it or not, the diaphragm, a muscle in the front of the hips, across the front of the pelvis called the transverse abdominis, the pelvic floor muscles, and then the very deep muscles in the spine that help stabilize segment to segment and move sort of individual segments of the spine. That's our true core. Okay, so doing a bunch of sit-ups or doing planks or something like that, although in a situation where you don't have pain and haven't had it before, maybe, or it was a really long time ago, some of those things might be beneficial, but when we have active pain and we're treating it, those are not usually the areas that we're going to go to. We're going to get those stabilizing muscles woken up, working better, and then get into more strength and endurance of those to stabilize that area. No, definitely not jumping ahead. I think that was a great way to sort of bring a few of those things home and talk about how, in a specific case, we're going to address those things. So thank you for that. Thank you for that, Ken. Joanne, it looks like you were typing something. I'm not sure if you had a question, but if you're having any trouble with the chat, feel free to kind of save that question for the end, and we can sort of unmute and make sure that we get your question answered. And again, at the end of the Q&A, I'm gonna have a couple things for you all, just as a thank you for joining me today. So definitely stick around to hear all the great questions and for that as well. So as far as prevention goes, if we know how to treat back pain effectively, like what I just described, we can take some of those same principles and work on some of those muscle groups that I often find are weak for people, and start working on them now. Because even in people that don't have pain, or maybe they have pain that comes and goes and maybe clears up on its own a little bit, in my experience, these muscle groups in and around the hips specifically are usually weak and or not activating very well. It's also not a bad idea to get the core going a little bit in these situations, even with just some muscle activation type exercises. So what I want to do is, I've got a couple of videos that I've put up on my Facebook page that I've done in the past. If you want to find me on social media, you can search myself, my own page. I put a lot of information up on that. It's Phil Finemore, Finemore on Facebook, or you can find the page for my practice. It's WorkFitME on Facebook, and I'll pop right up. So definitely check that out. So let me get that kind of queued up here, because I want to go over one of those videos here. Good. That is all queued up. And I'm going to go into a screen share here real quick. Okay. Should be looking at a video right now. So I'm going to start this. This is a good core activation exercise, and it's going to help activate that transverse abdominis muscle that I talked about. This can be good for prevention, and if you have pain, specifically for this one with standing and walking, this can be great. If you have pain with bending over and sitting, you can still do this, but it's just going to be a much smaller motion at the hips that you're going to want to do. So let's look at this first exercise. It's called a posterior pelvic tilt. Some of you might have done these before. So you can see I'm using my lower abdominals in through here to just gently roll my hips back. Let me show you that again, because we're going to go into bridges next. So that's the start position. That's the end position. So you can see that I'm activating the lower abdominals. I'm not activating very high up, right? Like the belly muscles aren't really working. It's lower down around my hips, and just gently flattening the back into the floor. It's going to help isolate that musculature pretty well. And again, if you tend to have pain with long periods of standing or longer periods of walking, this is a great one. If you tend to have pain with sitting for longer periods or bending over, you can still activate those muscles. Just don't roll the hips back as much, because that can potentially irritate some things. But if you have active pain, definitely let me know, and we can go over some things. Even at the end, we can stay on a little bit at the end and go over a couple things, because again, it has to be treated differently. But this is a good prevention type exercise. See if you can isolate that muscle. See if you can do this movement as a prevention exercise, and that can help get that core activated a little bit. Let's move on to the next exercise. Any quick questions about that at all? If you do, please pop that into the chat, and we can definitely answer that. The next exercise we're going to do is called a bridging exercise. So this is a great exercise to activate and strengthen the glute max, or your buttock muscles. Okay, so I'm going to keep playing this. This is the pelvic tilt. So we're going to get into the bridge next. So this is the start position right here. Knees are bent, arms just down by your side on the floor. Before you lift up off the floor, you're going to squeeze your buttock muscles and then just lift up and back down. So we're not holding that up there at all. Let's back that up a little bit and go through that again. Not holding it up there, just nice, slow, and controlled, and really making sure the buttock muscles are activated during that. And you can see, I'm going to pause it right here. You can see I'm in a pretty straight line from my trunk to my hip, but my hips are a little lower than my trunk, which is okay. Sometimes people have a tendency to go too far up. They go too high, and that actually makes the back arch, okay? If we make the back arch, we're not isolating the glutes, the buttock muscles, and that can cause discomfort in the back if we're doing it incorrectly. Again, the biggest thing here is making sure that we are squeezing the buttock muscles before you lift up. Another thing I'll say about all of these, I'm doing these on the floor. If that's too uncomfortable for you or you can't get down on the floor, please do these on your bed. You do not have to do these on the floor. You can do them on a couch. You can do them on your bed. You don't have to get up and off the floor if that's too uncomfortable for you. But if you're okay with it, by all means do it. This one right here is quite safe to do if you have pain and you're not really sure where the pain is coming from, because we're not putting too much stress through the back if we're doing it correctly. Again, if you have pain near the top of this motion, stay shy of that pain, okay? The next one I'm going to show you is called a clamshell exercise, okay? So I'm going to pause it right here. I'm doing this with a band. You don't absolutely have to have a band, but if you have a looped exercise band, that's the best way to isolate some of the muscles on the side and back of the hip that are really important to stabilize our low back when we're moving and walking around up on our feet. So you can see here, my knees are bent. My ankles are right in line with my hips, okay? So if you looked kind of from my head and looked down this way, everything right through here and down to my ankles would be in a nice straight line, and my knees are forward, okay? So all I'm doing here is my feet stay together and my top knee comes up. Just like that. Nice, slow and controlled motion. Let's go and look at that again. Nice, slow and controlled motion. I'm not going up too high. You can see that as I come up, my hip isn't rolling backwards at all. So if you're coming up so high that your hip rolls back and you start rolling back toward the floor or the bed that you're on, we're doing too much. Okay, and that's not going to do what we're trying to get it to do, which is stabilize the hips, which is going to help us stabilize the spine. These muscles that we're working in this exercise are often weak when we look at back pain or folks with back pain. So working on these as a prevention measure is great. So with that, just so we can go over this a little bit, I'm going to stop my screen share real quick. I want to make sure no one put anything in the chat here. Kim brought up a great observation. Are these exercises things that you can do in a position that bothers your back? So doing the pelvic tilts while standing, something while bending. Great question. With the pelvic tilts, yes, if you're standing and you bend your knees a little bit, you can pelvic tilt in that position. The other two I showed, not as much, because we're trying to isolate certain muscle groups. Although standing or sitting and just squeezing your buttock muscles, even though it's not a bridge, can help get them activated and get them working a little bit, which certainly can take some stress off of the back and just help wake those muscles up, because sometimes that's what we need to do. If we're not used to using those muscles, that's probably why they're weak and we're not using them as well throughout our day. very good to just sort of wake them up a little bit. And so you can just squeeze and relax the buttock muscles in standing or sitting. But the pelvic tilt, I show it on the floor because it's the easiest way to isolate it. But you can do that sitting, and you can do that standing. Again, if you're in a position and you do that and it causes some pain, back off of that and do it in positions that don't cause you pain. But that one you can adapt to different positions. Yes, you certainly can. So with the pelvic tilts, I usually have people hold each rep about 3 to 5 seconds as they can. Do about 30 of those in a row. And that one, it's an activation exercise. So you can do that multiple times a day. 2-3 times a day is perfectly fine with that, because we're just trying to get that core activated, get your spine in a better position that's a little less stressful for it in a lot of situations. Or again, if you don't have pain, it's just a good way to get the core activated. Bridges, you can do 3 sets of 10 of those once or twice a day is perfectly fine. Clamshells, 2 sets of 15 of those is best. And I will make sure, I'm going to type that in the chat real quick. Just so that you all can have that and refer to it and write it down as you need to. Any other questions about those first couple that I showed you? While I type this out real quick. Great. So that's all right there in the chat for you. If you'd all like to copy that down, you certainly can. And I've got one more that I wanted to show you all, and then we can get into a bit more of question kind of discussion time. Another good hip stability exercise that gets multiple muscles working and does something functional that we do every day that some people do have back pain with, is a sit to stand exercise. So let me get that queued up here, and I will share my screen one more time with you here. Okay, so all we're doing here is oh no, hold on, let me Facebook is having trouble playing the video, so let me queue it up again here. Just a second. That's why I did this ahead of time, so that wouldn't hear me talking and we could find the video. Okay, it's working for me now. Let's do this. All right. So all we're doing here is standing up out of a chair. I'm just explaining here in the video that you want to keep your chest up tall as you lean forward and hinge at the hips, and you're just standing up out of the chair. Okay. So by keeping your chest up tall, we avoid really rounding the spine. And it's also going to allow us to make sure we're using the buttock muscles and our thigh muscles, our quads, correctly. Okay. Those are the 2 muscle groups that help us get out of a chair. And if we really round our spine and almost lay our upper body on top of our thigh muscles don't work as well. And it's harder for our buttock muscles to work too. Okay. So by keeping the chest up tall and hinging through your hips, it allows you to keep the form that we need at your hips and knees to make sure that we're using the muscles that should be used to get you up out of the chair. Okay. So I'm going to keep kind of playing the video here, because we should do that a couple more times. Yep. So up nice and tall, lean forward at the hips. And as my buttocks are leaving the chair, I'm squeezing my buttock muscles on the way up. Okay. A lot of people, I'll stop the screen share here. A lot of people let that kind of deter them from going through the natural motion, but you don't have to crank on those muscles. Just think about activating them and getting them working a little bit as your hips come up off of a chair. Okay. Another way to help you do that is to think about driving through your heels. So as you're lifting off that chair, think about driving your weight off that chair through your heels, and that's going to help you come on up off the chair. One thing you'll notice, it's going to be a lot easier than the way you might be getting off a chair right now. And 2, you'll definitely feel your thigh muscles and your buttock muscles, your glutes working to do that exercise. Again, that one's really great. I mean, getting up out of a chair is the same thing as a squat, right? So if that's too easy for you, you can certainly do a squat, but this is a good way to make sure that you're doing this with good form and doing it correctly so that the glute muscles are in fact working. Okay. Again, they're very, very important in stabilizing our spine. The muscles on the sides of our hips and the back of our hips, which is what we're working in all those exercises I showed you, along with the core, are very important at stabilizing our spine while we're moving. And it's when we're moving most of the time where that uneven amount of stress is being placed on that certain area of the spine that has something going on that then irritates a nerve and causes that pain to go either in the back or down the leg or whatever the case might be, whatever sort of symptoms someone might be feeling with the back pain. So again, the core and the hips are what I really hit on with prevention for people, because I find even people that don't have pain have deficits in those areas that we need to address so that it doesn't lead to back pain down the road. There are certain areas of mobility we can certainly look at too, but I think those 4 exercises right there are kind of the biggest bang for your buck type exercises, because they often get the hips and the spine moving in a way that'll help loosen things up a little bit anyways. And if we stabilize things, it can go a really long way. So with the sit to stand exercise, doing about 3 sets of 10 and doing that a couple times a day is also perfectly fine. So I just put that in the chat as well, so people can certainly jot that down here while we take a few questions, because I think with the time we have left, we can definitely use that for questions. I know we hit a lot there, but I hope I got to a lot of the things that you all were hoping to get out of this. So for questions, if you want to, you can either type it in the chat, or if you want to unmute yourself and ask a question, by all means, please do that. All right, we do have one question in the chat here. When you tweak your back, why does it linger for days, and what can you do to get yourself out of it quicker? That's a good question. It really kind of goes back to what we talked about earlier in the session, where it really depends on what structure it is that causes the tweak. Sometimes that's muscle. So let's just take the example that you strained some musculature in your back. But even if it were a disc issue, right? You irritated a bit of a disc bulge that's pushing on a nerve and causing some pain in the back. It really goes back to the fact that some of these areas right here that we've talked about with the exercises are probably weak already, right? So some of those muscles already have some weakness going on, and now that back is in some pain because of whatever activity it was that you did, more of that stress is being placed on it just when you move around and do your daily activities, and it takes longer then for it to clear up on its own. Even though it does, our bodies are very good at healing themselves, and even with a disc bulge, our body will naturally heal up that bulge material on its own over a little bit of time, somewhere between 6 and 12 weeks. But if we keep putting stress on it by not modifying our activity and not addressing these imbalances that I've talked about so far, it'll continue to stay in that cycle and not have a chance to heal up. So I hope I answered your question there.
Yeah, I'll chime in a little bit more.
Sure.
It's the thing that usually happens to me is I'm just bending over to pick up a towel in the drawer at the bottom of the counter or whatever. So I assume though, when I do work on strengthening everything, strengthening hips, core, whatever, that will happen less, unless there's an issue in the musculature or in the discs or whatever that's just going to do that.
Sure. Yes. No, you're exactly right, because those are the areas that we would work on to get you out of that pain a little faster, okay, without having it happen on its own. And some people have exactly what you just like. How can my back be strong? I mentioned our backs are strong. They take a lot of force during the day, and they take a lot more force than the force it takes to bend over and pick up a towel off the floor. But it's a mechanical thing. We're putting some of those muscles or potentially the disc or whatever the case might be for you at a bit of a mechanical disadvantage and asking it to work. Okay. So if we stretch a muscle out, pretty safe to say that it's probably musculature for you if it happens that quickly and clears up on its own. If we stretch a muscle out and then ask it to work, that can cause strain. But if the glutes were a little more active in that bent position and your body was a little better trained to use your glutes to get up out of that position, you wouldn't be using your back muscles to return, because it's probably more of like trying to come back up, right? You bend over, pick the towel, and you go to move again, and boom, you've got pain. So yes, you're right. If we secure your hips up a little bit and get those muscles working a little bit better, that's less likely to happen for sure. Yeah.
Do you have appointment times tomorrow by chance?
Yeah. Not tomorrow, but Friday. I do have one or two left on Friday. We can work that out for sure.
I feel like this webinar has been like totally for me.
Yeah, right.
Thanks, Phil.
Well, you booked it, so great. We have another question in the chat here. So this is good stuff. So Lefty, Lois, Missy, Sherry, this is great stuff here, because it can relate back to all of you in a one way or another. So the question here is, I've had osteoporosis since age 24 and have chronic back pain, neck and shoulders and upper back. Now at age 33, and I deal with pain each day. What can I do to help? That's a great question. So with osteoporosis, it's a little trickier, because that's where your body is sort of naturally reabsorbing bone in a certain process. We won't get into all that, but that's not as much of an injury per se, or like a stress on that area over time. But if it makes you feel a little uncomfortable, you're maybe a little less likely to move in certain ways. And some of these imbalances that we just talked about in the webinar can feed into some of that pain that you might be feeling from osteoporosis. So the best way, because osteopenia, which is a step before osteoporosis, so osteopenia can actually be reversed to, I now have no problem with my body absorbing bone anymore. And then osteoporosis can actually be pulled back into osteopenia. Sometimes that happens with medication, but it can also happen through exercise. So strength training. So Sherry, for your question, strength training is something that, as long as you're not doing things that are too heavy impact and you're doing things that are appropriate for your level, where you're at, having your muscles kind of pull and tug on the bones that they attach to can help strengthen those bones. So doing light impact or no impact strength training can be helpful in your case. And if any of you out there have osteopenia, actually doing impact type exercise, like even doing Tabata or HIIT, high intensity interval training type workouts, along with some strength training up on your feet, can actually push you completely out of osteopenia so that you have no bone density issues whatsoever. Walking's also great. Just walking and moving, getting the heart rate up a little bit, getting the blood flowing a little bit is great. But specifically for osteoporosis, strength training is still key. We just have to make sure we do it safely and do it the right way. So I hope that answered your question. Are there any other questions that people would like to unmute themselves and ask, or type in the chat? Be more than happy to answer a few more questions. Like I said, I do have one or two things I want to share with you all, as just a thank you for being here today, that I want to make sure that I get in and share with you before we jump off. So if there's anyone else that has a question, feel free to type in the chat or unmute themselves and ask. But if not, so I think for just about everybody that signed up, I do have an email from you. So I'm going to send all of you a copy of the ebook that I wrote on back pain. Okay, so some of it is going to reinforce some of what we talked about today and provide you with a little bit more information and go a little further down a couple of these rabbit holes that we talked about today in the 1 hour. Sherry, you're very welcome. Thank you for asking the question. So I'm going to send you all that ebook just as a thank you for being here. And the other thing that I want to do is what I always like to do with my workshops and webinars is I've been able to open up 3 spots on my schedule to do a back injury prevention screen for people that have attended the workshop. So my yearly, what I call PT physicals or injury prevention screens, are normally priced at $180 as a prevention service. But for anyone on the call now, and again, I have 3 spots for this, I'd like to offer that to you for $80. So I'm going to take $100 off just as a thank you for spending your lunch with me today. And again, a huge thank you to Kim and Coastal Pharmacy and Wellness. So if that's something you're interested, like I said, I have 3 spots. Please put your name in the chat and just say me, and I will make sure that I get your contact information, and we can set that screen up. So I wanted to make sure I offered that to you. So definitely put me in the chat, and I will definitely get your information. All right, so we've got a couple people. Actually, Lois, are you looking to do that? You said thank you. I'm not sure if you were looking for a screen, but please let me know, because I do have a spot left, or maybe I don't. So okay, all right. Just want to make sure, Lois. Oh, we've got 3. If anyone else is interested, please call me. Be willing to work with you a little bit. We do have 3 people that are interested. So those 3, definitely please stay on the call, because I want to get some contact information so I can reach out. And do you travel to Wisconsin? No.
That's my niece.
Okay. No, Britt, unfortunately, I do not travel to Wisconsin. But I do have
really fun.
I do have. I want to go. I really want to go to Madison and check out Madison. I've heard such great things about it. But I do have a big network of people who do mobile PT just like I do. So Kim, let me know where she is at, and I can maybe
Absolutely
reach out and say, hey, I've got someone who might be interested in some mobile PT services out in Wisconsin. I might have someone close by for you, Britt. So I will send someone your way if I can. Okay. Great. So all of you who wanted screens, please stay on the call just so I can get some contact information and reach out and set those screens up for you. The rest of you, thank you so much for joining us. Please come back, and the webinars that Kim was talking about at the top sound great. They got a pretty good schedule coming up, and Kim, they can find those on your website, correct?
Correct, on our website, and then they'll also be on Facebook for those that aren't no, I was going to say, for those that aren't on Facebook, definitely go check out our website. They're on there. And then I also wanted to chime in and remind everybody that this will be posted on YouTube, and then I will upload it or I'll post a link on Facebook. And
Wonderful.
Also, if you did sign up on Facebook and we don't have your email address, I'm going to post Phil's contact information in the event, and you can just go there and get that.
Wonderful. Yeah, I have email addresses, I think, for like 9 people. And it looks like we had 10 or 11 in the webinar. So yeah, if we don't have the email, please reach out to me either through Facebook or through that contact information that Kim gives you. I definitely want to make sure you get that ebook as a thank you for being here. And yeah, that's all we had. So
actually, Phil, you might want to
yes.
Pop your email address in this chat.
Oh yeah,
for people who
I can do that
right away.
Yeah. So that is my email. So if you shoot me an email, if you didn't have your email to sign up and you got this through Facebook, if you got an email from Kim giving you the link, I have it. But if you found this through Facebook, please shoot me an email. You can always use that email for any questions that you all might have. That question comes up that you're like, oh shoot, I wished I would have asked that. By all means, reach out to me, shoot me an email. Be more than happy to answer that question for you. Wonderful. Okay, so for those of you that are interested in those screens, please stay on the call. I'll just get a quick contact info from you. The rest of you have a great rest of your Wednesday and a great rest of your week. And thank you all for joining us.
Thank you, Phil. That was very valuable. Great.
Thank you.